So hi everyone, thank you for inviting Chrissy and myself to speak today. I firstly would like to, before we kick off the presentation, just like to acknowledge the traditional custodians of the land in which everyone is gathered on and speaking from today. I would also like to pay my respects to elders that have passed, elders present and emerging. Just in relation to the Literature Institute, they'd actually done a report on the emergency responses for Indigenous communities and how community-controlled health services responded to the devastations of communities that were impacted.
So there was two organisations involved in that. So Wominda being one, ourselves, and then Katungal, another Aboriginal medical service based a bit further down the coast. So the case study overview. So yeah, our example is based on leadership and legacy through crisis. An example of Aboriginal health, Aboriginal community controlled health organisations coming together to respond. So I thought we'll just add a bit of about what an Aboriginal community controlled health organisation, and you'll see that I've just included NACCHO, which is the national peak body for us across the country. So you'd see there's 143 Aboriginal community controlled health organisations across the country, and state-based in New South Wales, we actually have AHNMRC, who's the peak body for us. So it basically, for us in Aboriginal community control, is working within our community, for our community, responding to community needs, Aboriginal health in Aboriginal hands.
So our service has been in operation for the past 37 years this year, where we are a service that supports women and their Aboriginal children. And we look at the whole of life cycle, where we look at the health and wellbeing of our people, also the social determinants of health as well. It's also looking at, individual people and families around culture, around their connection to their land, their language, their spirit.
So you'll see on this map, just though the data is not up to date, it's just as a map for the southeast coast of New South Wales where we operate, and Katungal also operates further down near where you'd see Eden. And unfortunately, Katungal couldn't join us today, so we'll just present on the work that we've done together. And I've just got a bit of information down the bottom around what AHNMRC is, this state peak body. So just a bit of background to the report. So basically, in the summer of 2019-20, we had devastating bushfires across the southeast coast. So Shoalhaven, where Wominda's based, was directly affected, although further down the coast, where Katungal is based, was even more so affected. I think background to the work, we already have a health disparity gap when it comes to Aboriginal and non-Aboriginal Australia. So that's a concept on why services like Wominda and other Aboriginal community controlled organisations exist in the first place.
So during the bushfires and the responses, not only did it affect the health, the wellbeing and the safety of our people, but it also destroyed the sacred sites, the habitats of animals, and destroyed the vast country in which both the organisations, Wominda and Katungal, work within. And I guess too, just to add on to it, Wominda's response, after immediately when we'd just come off our leave, because it was around that Christmas period time, our first response was to immediately check that not only our staff were safe, but also our communities were safe. We purchased, and distributed emergency supplies to all the communities up and down the far south coast. And we also extended operations beyond our boundaries and our core business to ensure that we supported Katungal Aboriginal Corporation in terms of the service delivery further down the south coast, to ensure that all of our communities were being supported during this difficult time.
So part of the challenge that we faced, and so like when we stepped in, we didn't wait for funding, we didn't wait for mainstream or other responses. We just got straight in and acted straight away. So as a service, we had organised for, like Lisa said, all the basic needs, but medical supplies as well, to be packed up, water, food, and transported down immediately. We entered some of the communities that emergency services hadn't responded yet. And I think the other the impact that we have for us is that we already have a homeless crisis living like for Aboriginal people, but in this area as well. So we had people already residing in tents, and they're not eligible to ever have some support when it comes to housing and that, because of they didn't have a home. So there was multiple levels of that impacted community, and then just trying to get food, and that was another issue.
And prior to us actually going into the communities, what we done is we contacted all the local Aboriginal land councils with each of those communities, where we spoke to them and we asked what support was it that they actually needed. So we listened to what the community was telling us before we actually went in and made the responses. One of the biggest challenges too that we'd found and talking with community was around culturally unsafe services being provided by mainstream services and also charitable services as well, which greatly impacted on our people.
I was going to say the other part is that when Katungal done some work with Australian National University, and it was found that there was no specific needs of Aboriginal, like there was no the needs of Aboriginal people in response to the emergencies, not even on the mainstream agenda. So in the response and recovery programs, it wasn't on the agenda. So we had several community members off country seeking supports and that. And I suppose with the fires itself, like we had the challenges that we had the fires, but then we had the extreme floods straight after, and then went straight into COVID, the impacts of that. So in the bushfires itself, which the worst night started Christmas Eve, and then went through to New Year's, but 65% of the far south coast was burnt, and the claimed several lives. The smoke from the bushfires blanketed the south coast for several weeks, which reported high levels of air pollution and resulted in increased clinical presentations and concerns relating to asthma or respiratory conditions. And then, on top of that, we had eye irritation, cardiovascular and psychological concerns that the community were impacted as well. There was recommendations to wear face masks, and fortunately we were able to access that through our peak organisation, AHMRC, quite quickly. But trying to just keep community safe and staying indoors, so they weren't impacted by the air as much while we delivered food and directly to them. So lessons learned for us is, Aboriginal community health services leading the way in primary care. There's been several reports done since about how mainstream, the broader Australia can learn by our model of care and how we respond to community need. The fact that we work in community and it is our community, is always culturally driven. It's responsive to community need ongoingly.
Also, just in relation to, lessons learned, consultation needs to be done with communities to ensure emergency management plans are incorporated and the voices of communities are heard, as to the needs of their communities and how their communities are affected. but I also think listening and consulting with First Nations people and land management is a big thing.
So yeah, going back, and I think one important message also from Aboriginal perspective, we have one of the oldest cultures in the world that has cared for this land since time immemorial. So why we will need to be more open in consultation and going back to traditional methods of caring for land. If it was acknowledged and actioned, we wouldn't see the devastation we've seen recently in the fires, because there's areas down the coast that were traditionally managed and they weren't impacted like the others. So, you know, acknowledging and learning from that. And as First Nations people in Australia, we're heavily aware of the gap that and disparities we have across the country, but we have the solutions to close that or eliminate it completely. We should be striving, on our own land in our own country. So, you know, investing in that, acknowledging that, and building on it. And I think next steps are just, you know, as we'll continue to advocate for our communities, we'll always be at the forefront for our communities. As a health and wellbeing organisation, you know, that's our core business day to day across the entire region. Did you want to add anything else? Yeah, so thank you. We've just left some information how to contact us if there's any other questions, and I'd like to acknowledge Kitungul's the partnership that we've done together to respond. And, you know, when it was just way we'll be able to link in to partner services like Kitungul to respond to community need when they were right in the midst of the fires. Thank you.